Welcome to Candidly Creative. I'm Ilani.
And I'm Lisa.
This is where we connect with people, their ideas, and passions through conversations. Hi there. I'm Ilani.
And I'm Lisa.
Welcome to Candidly Creative.
And it's actually our very, very first episode of Candidly Creative. And we're just going to have candid conversations.
Random and candid conversations, just discovering people, their passion, ideas, just basically connect.
Right. And today we're going to start off with a pretty interesting story, I think, right?
Yeah, it is. Yeah.
We're going to talk to a mom.
And her husband.
And her husband about the effects of gadgets on a growing child. So this is based on their own experience personally. So right. So without
further ado, we are going to bring in Nabilah and Salleh. Okay, hi guys.
Hello, Nabilah. Salleh. Good morning. Thank you for
doing
this and having just very chill and candid conversation with us.
Right. Well, to start out with,
wait, how are you guys doing? Like in general, like how are things with all what's ever going on at the moment?
Things are okay aside from having two kids around.
Okay,
we're doing fine because we have some free time in the morning before they come back from school. Yeah,
and they're back. They are in school now. Yeah,
they're in school now.
Yeah, they're in school till 6. Yeah.
Okay. All right. Okay. So
right. We've, like you said, we've actually first discovered you, ran into you through your, the Facebook post, your viral Facebook post that got us really in awe. I mean, really sincerely, like in awe of your candidness, your courageousness in being honest and just, willing to be open and talking about it. So
about what? We haven't explained like what?
What about Martin and what you were going, what you were going through at that time, and what your struggles were, at that point, and it kind of grabbed the both of us, because you know what we do is we are focused on children, their development, and just finding a balance of between electronic gadgets and the child parent relationship. So yeah, I guess I better stop talking and let you tell. Let you tell your story. And
I just have a question. Did you know what you wrote was going to? There were a lot of positive response. Like when you wrote that, right? It was on a Facebook update, right? Page that you wrote that, correct?
Yeah.
So when you wrote that, what was going through, your mind?
We just wanted to share our experience. We didn't actually expect it to go to went viral at that time. So.
Yeah. So yeah, I mean, explain to the people who are not familiar, what exactly did you write, in that post of yours?
And so they feel
okay,
in.
Yeah, in case I'm nervous.
Okay, sure.
So Matin is our firstborn. We have 2 children. So Matin just turned 3, in fact, last week. And our second daughter is 1 year old. So Matin is a typical boy. He's cheerful, he's playful. But we noticed his change of behavior during my confinement. So he started being difficult, throwing tantrums, but he was also more and more on Gadget at that time.
And how old was this?
So we started introducing gadgets to Martin as young as 6 months. Too early. It was too early. So he was on screen, he was on gadgets, I would say, most of the time from morning till night.
Okay.
When we say gadgets, okay, we're talking about the phone. Yeah, I mean, like, was he on the phone, on,
iPad?
Yeah, he was on the phone. He was also watching television. He was on iPad. So most of the time he was on screen. He was watching
like a
screen.
favorite thing that he would watch. You said as young as 6 months, right? So what was he watching at 6 months old?
What was his thing then?
Mostly it was Coco Melon, nursery rhymes.
Okay.
Then we started introducing Monster Truck because he likes cars.
Okay.
Yeah. So then he started having it was his behavior that changed that got us worried. So he had many confusing red flags. So while he was watching Gadget, he was on the phone. He will not sleep. He does not want to sleep. He does not want to eat.
Oh my. Okay.
So yeah, he does not want to eat. So he is very tiny, I would say, for his age. In fact, he's only
time for yourself as well too, because he's like constantly on, right? So you don't have that downtime for yourself as well. Some babies have like sleep time and all that. So you were constantly like tired too, I'm guessing.
Yeah.
Can imagine.
Because he would sleep around 5 to 6 a.m. in the morning.
Oh my goodness. Okay.
But while watching YouTube, so that was our mistake as well. So while watching YouTube,
so he just like watched something and just like fell asleep while watching something.
Yes.
Okay.
Yes, correct.
This I just want to add a bit. His character was similar to any other addicts. He doesn't want to eat, he doesn't want to sleep. He just want his YouTube fix, and that's it. That's his only life. So when he screams, he just want power to his phone, and that's it. There's no anything. Even up to a point, eating was very difficult for him. He doesn't need to eat. He just need to watch his YouTube. So that is, I could say, his only supplement to his needs. So after that, during the MCO, that's the point it reached to our limits, and was a bit frustrating because during MCO, I had issue with my workplace, and I got retrenched, and all those things happened during at the same time. So all the stress, the anxiety, the anticipation erupted at the same point. So I think that's when in a way, I find it's a blessing that, if I didn't get retrenched during that period, I think I will still carry on with that same routine, just feeding him with YouTube, and that's it. Because last time we used to be career-oriented people. So we leave home early in the morning and then come back very late in the evening. So by the time when we come back home, we didn't have much energy to entertain, and then you get all the stress from work, and then we just focus work, we just don't care our kids. So I think there's a blessing to it lah. That's how we view it. And now alhamdulillah we are working on it lah.
So you it's interesting, you used the word addict, right? Like to describe what he's going through, which is a big word, I think. And I think was it hard for you to sort of like see it, like realizing it is an addiction that he's having?
Yeah, because I guess using that word, which is true, but then the difficulty in admitting that is real. You know what I mean? Like noticing that and admitting it is a huge thing. So
when did you decide you realized it was an addiction rather than just like kids being kids? I think
what was the tipping point? I guess what what was the tipping point? Any particular incident that was like, okay,
the tipping point was because at the time our second child is still a baby, so she only sleeps like like she wakes up every 3 hours, right? You have to feed.
Yeah.
Have a proper sleep. Usually after Martin falls asleep at 5 a.m., then our baby will wake up around 7 o'clock. So for 1 month we only got 3 hours of sleep, and it's just driving us crazy. And then we're just not thinking straight, doing very erratic stuff. So we find this is not very healthy. And then we start throwing blames around, kind of thing, when you have not enough sleep and anxiety and all this thing. So that is the tipping point lah.
Can I just add to that? Aside from that, right, we noticed that Martin does not respond to his name. So whenever you call him out, he does not respond, and there's no eye contact. So I thought it was only whenever others call him, but in fact, it's also with us. So he doesn't respond. He doesn't understand simple instruction. And he started throwing tantrums and banging his head on the floor.
And how old was he during this that you noticed this?
2 years old.
2 years old. Okay.
So that were the confusing red flags that we were actually concerned of. So he also started playing with only the car wheels. The way he plays toys are different as compared to his peers.
And
were you
aware of these differences? And like, I mean, obviously you observe him, right? So it was just, and he is your firstborn too, correct?
Yeah.
So you noticed it was just not like how other children were like playing at all, or it's just a mother's instinct too?
Well, to be honest, we were in denial initially.
Okay.
Because we thought it's just a matter of time. Maybe he's just adjusting to his sister.
Yeah. Okay.
But my mother, my grandmother, most of our family members insisted that he needs help.
So it came from other people, from the other family members, to sort of like make you take action. Is that it?
Yes.
Yeah. Okay.
Especially my grandmother, because she normally would call us, "La, Matin tu pakak ke lah? There's something wrong with him. You need to get him checked."
Okay. And I guess the reason you did sort of like do it earlier, like you say, is denial, right? And where does that denial? The denial is because of what? Do you feel bad, or you just don't want Martin to,
I think it's because we felt bad. That's also one of it. Another thing, in terms of his speech, we thought that just give him time. Probably it's just a matter of time for him to pick up.
Yeah.
And we thought it's probably a phase that he's going through.
So like Salleh, you said, like, you guys are busy with work. So I guess there isn't time where they have like, you read to him together. So there wasn't like that sort of like moments that there would be time like trying to like figure out his speech. So I guess that didn't sort of like happen.
No, because at the time I was very focused on my work.
Right.
I come back home, there's still work. It never ends.
Yeah.
Right.
And I think it's a good sign that actually I left the company. I mean, I got retrenched, and I just realized, I've been chasing work, which doesn't really make ends meet at the end of the day.
Yeah.
It's not solving anything. It's not even solving my financial situation.
So it's almost, it's not solving the problem. It's not solving the family's problem too, right? So it's just like it's just there, right? Totally get it.
Yeah.
It happened.
And
Go ahead.
Sorry, just a bit more. And then we just realized that because last time I had private medical care from my company. So we after I got retrenched, we started going to government. And then we just realized actually government has a lot of help, and actually if we started Matin from with government care from the beginning, we would have not end up in this situation.
Can you share with us
Which
like
I think a lot of private sector are missing.
So you started sending him to a private, like that's how, like can you tell us like
the journey,
when you got help for Matin?
So you know, you got the thing, okay, Matin needs to check, okay, let's take it from, you know, let's take it from there. Said, okay, Matin does, you know, like we need to have him check. What did you do?
I mean, for parents who don't not even know maybe what's the process, right?
Parents that, you know.
Okay, so when we brought him to see the local doctor over here in Mutiara Damansara, she observed Matin's behavior. So after the observation, she mentioned that Matin was showing traits of mild autism. So those red flags were the autism's red flags. So he had more than 5 red flags at that time. So aside from not responding to his name, right? So whenever you call him, even when the doctors call him, he does not respond. And whenever you try to tap on his shoulder, he does not respond. Wow. So he doesn't look at you.
Right.
It's like he's in his own world. Right. But to properly diagnose him, whether he has autism, the doctor would have to do an assessment first. So we had that 1 month gap before the assessment.
Okay. And so you went through the whole process of assessment after that?
We did. So during the 1 month before the assessment, the doctor advised us to send him to play school for him to socialize and to cut his screen time to 0.
Oh, to 0.
To 0.
Was that tough?
It was at the beginning, but he got used to it. But we need to keep him occupied. It was tiring from morning till night, but it was worthwhile, I would say. So we brought him to the park. The father brought him to the park. We played with him. We did arts and crafts. So there's some truth to the fact.
There's some truth to the fact that kids, if you don't give it to them, they're not even going to care, isn't it? Right? They're not even going to care, really.
Yeah,
yeah, they're not even going to care. Right.
Okay, Salleh, you said that you went to the government facilities, right, to get him help after that. Is that right?
Yeah.
Okay.
Actually,
where do people go? Where do people go? Like I sometimes I read through threads, like people just do not know where to head when, you know, these kind of things happen. So how can you tell us, like, you know, where you went to, how to sort of like get help?
What were your resources?
Okay, firstly, we knew because our second child she has been following up with government hospital. So after when we got the red book, then we saw actually all these things, all these issues that Matin had is mentioned in the red book. And I realized that when I spoke to my friends who doesn't go to government hospital, all of them facing the same thing. They are not well informed from the private sector healthcare. For them, we thought the same after our child is born, and then we do follow up with the doctors, whatever thing, and that's it. But with government, we realized with our second child, actually there's a lot of thorough checkup and information that we have to go through. And then first thing what we did is we head to our local district government clinic and register. And from there we just follow up from there.
So did they
the most important thing. Pardon?
Do they go to the pediatrics department? Is that where they get referred to?
No, I think the first step is you go to the normal clinic, the ibu dan anak clinic.
Okay.
Get yourself registered, and then from there they will advise you where to go.
Okay. So that's
Pardon?
That's a good start for anybody who needs help. Just go to clinic.
Yeah.
All right.
Yeah. So, but be mindful that people have the idea, this idea of, oh, I'm going to be there for the entire day.
Yeah.
I mean, if you go to the private clinic, also it will be the same. You will spending half a day there.
Yeah.
And you're not saving any much time from there.
Right. Maybe you just get AC though. That's it, right? You might get the air conditioning.
You might get
you might just get the extra air conditioning.
Oh yeah.
Yes. But now clinic, the one that we got is in Taman Tun.
Okay.
And they have AC over there, so it's very comfortable.
All right.
It depends where you are. If you're in Puchong or Kelana Jaya area, I think
maybe less on the AC, yeah. Half AC, half like outside.
Yeah.
Yeah, suppose it's the AC, you're right.
Yeah. Okay, great.
So,
and actually the beauty with government clinics, actually they do follow up with you. They do chase up you. It's not, we thought that they don't do their work, like if you don't come, it's fine, it's much easier for them. But actually they ring you up.
Okay.
And they will ask you a reason why you
help.
didn't turn up for the appointment.
Okay.
And if you miss the appointment, they will strike you out and you have to wait for months. So you have to be very punctual with your time, especially with your scheduling.
Right. So so he's doing therapy right now?
So what is so you go to the clinic, they give you all this thing. So what was the resources, so what is his treatment? I mean, what is his process now, his treatment right now?
Since his diagnosis was only delayed in speech, delayed in communication, speech delay.
Yeah.
So the doctor referred us for Matin to undergo speech therapy. So now he's going for speech therapy. So far he has improved a lot. There's more vocabulary, but he is still not at par with his peers. But he has improved. He understands body parts. He understands ABC. He understands the WH questions, where and what. But he's still having some difficulties trying to form sentences.
But from the videos that I see you post on Facebook, he seems a lot more cheerful. He seems, like he seems to be smiling a lot more and just like, coming out of his shell a little bit, from the videos that we've seen. So
just backtrack a bit. So was he diagnosed with autism or just speech delay?
Just speech delay. We actually asked the doctor because we were curious how come all the symptoms disappears. Because all the red flags suddenly goes away. He responds to his name. He no longer throws tantrums. He has eye contact.
Oh wow! Okay.
So now he plays like normal kids. No more spinning of the wheels, arranging toys. So when we asked the doctor, right, she mentioned that when you're overexposed to screen, you tend to get autism-like symptoms. Symptoms like autism, but not autism.
Not autism, like symptoms.
Symptoms like autism, but so that is why you need to cut the screen time to 0. So if the symptoms are still there, so then that child is autistic.
Oh, get it. Oh, that's an interesting fact.
So it's autism-like symptoms. But if you don't get help, if you do not acknowledge their problem, so the symptoms will become a habit. So when it becomes a habit, when you see a doctor, so the child would eventually be diagnosed with autism. Because it's already a habit. So
it's a habit, right?
It's a habit to them. So the only way for us to know is to cut the screen time to 0. It's called because the doctor says that it mimic autism. The symptoms mimic autism, but it's not autism.
So that was the whole month period you were talking about, that he was like off. So he was off gadget for a whole month.
He was for the whole month, right?
Wow. Did he ask for it though? Did he like you know, like you say, he's an addict, like you add, like does he want it?
What was his reaction? Like once you say, okay, you're not, you know, we're not gonna give you the phone, the iPads, or you know, whatever screen, you know, your screen time. What was, you know, okay, he got over it. But initially, what was
how did he react?
How did he react?
He ask for it? Like if he falls asleep with YouTube, right? So
that is true. To be honest, what we did was that we had a timetable for him. So when he got up, we would bring him for a short walk. Around the neighborhood. So we make sure around between 9 to 10, he goes for a short walk. And then 10 to 11, he has his arts and crafts session. And then 11 to 12, he has his lunch. So I think he forgets about the gadget during that time. But we had to keep him occupied most of the time.
So what is it about, let's say about arts and craft, right? I mean, it's like, it's synonymous with children's arts and craft. What is it you think about arts and craft that, you know, keeps a child like Matin, like busy, like focus? Is it the same kind, do you think it's the same kind of focus of having an iPad, or is it a different kind of focus? I mean, both require,
What's the
it's a different the way he engrossed to a particular thing is different. If gadget, I notice within 15 minutes is fine because they have some sort of interaction. They start talking to the screen, singing, whatever. But we notice after it passed the 15-minute mark, then they will zonk out immediately. They will just be there like a zombie, and nothing is happening. But if he's engrossed with arts and craft, because there's so many components of the brain have to work together, it's totally different experience. If he likes it, he would engage for quite some time. If not, he just play for a while and then he'll do something else.
Right.
It's a passive, positive, say, active participation as opposed to like, you know, being zombie-like you said, right? You know,
I think screen is it just keeps on moving. You don't have to participate in it. You just watch it, right? You just watch things goes.
I mean, for us, we can't stop kids watching all this media, whatever thing, because
no.
They still need to understand the world outside, and then the world is revolved around gadget. That's something we cannot suppress. Unless we decided to live up in the mountain, we can forget all these things.
No connection.
Which is we are not those kind of people.
Go ahead.
So there is a need. You have to cap it. I mean, as parents, you have to know the best time for your kids. I mean, each kids will have slightly different, method. You know, some kids people might some kids they have to say nicely, but at the end of the day, you know, you yourself have to monitor, and you yourself are the best doctor to your kids.
You are right. It's not about suppression. It's about just finding the right balance for the child and yourself. You know, like it's not suppressing technology or screen time. No. So finding that balance and what's right for the child, what works for the child, and also what works for both of you as the parents, you know?
Because we notice that, for example, sometimes we do give a bit of gadget. I mean, I'm not denying. Sometimes additional 5 minutes, because sometimes we have to settle some stuff, you know? In the laundry, whatever. But we notice after that 15-minute mark, when we try to take away the gadget, it will start scream and yell. But only for a short period. But less than 15 minutes, he's fine. We just distract him with something else, and then he's just fine. He just do something else.
Oh, so you find the 15-minute mark as the magic number?
That is from our personal experience.
We try to cap it to an hour because we have just recently introduced him to gadgets. But we try to have the balance.
So what is his hours right now in the whole day of Gadget? Like how many
So,
hours does he get in
so
the
far
one
it's
day?
only half an hour. We kept it to half an hour, but not half an hour direct.
Okay, okay.
Now that because he goes to school till 6 and then he goes to the park, so he doesn't. There's not much time for gadgets anyway.
Okay. So I think in your this is obviously talking to your own experience.
From you, yeah.
What age would you, if you had to turn back time, like would you have introduced Gadget to Matin?
I think we would the age recommended is 2 years old.
2 years old.
2 years old. Because even with our daughter, we have yet introduced Gadget, and we see that she's different as compared to Matin. She's more talkative. She's cheerful.
Yeah. And she's not asking for the phone from you, because I think a lot of parents do battle with that. Like, you know, adults have their own phones, right? And electronics. And I think when the child sees it, it's like they want part of it. I think that's why a lot of parents do battle with the fact that, you know, macam kesian, like, oh, you know, like you kind of like want to give them something to play, right? So how's this the daughter handling it? Or she's just like busy?
Ava, how's Ava?
Busy.
How
So
are you with that?
when sometimes when we lie down, sometimes we just put our phone next to our head, whatever thing.
Yeah.
She come and fiddle with the phone, and then it's become a norm when we just snatch the phone away, and then she just wander off, and she doesn't cry or whatever thing. It's just for her. It's just another object around there that she wants to fiddle.
I wouldn't say snatch lah. Snatch tu macam kasar sangat.
My phone. So what would you tell other parents, like what you've learned from your experience, right? What would you
Okay, that you've gone through this, right?
Mhm.
And then what would you tell what other parents, about your journey, and what would, I know parents hate the word advice because, I mean, that
different child is
the
different.
different child is different. But through your journey and your experience, what would you tell other parents?
Well,
What would you say? Not tell. What would you say to other parents?
Because obviously your Facebook posts resonate with a lot of people, right? I mean,
It did.
Is it because I think maybe parents are not aware like gadgets can do that? Is that I guess back to your own experience, did you not occur to you, I think like gadgets can do that kind of harm, right, to a child's development, right? So I think, do you think it's fair to say, parents that introduce gadgets at 3 months or 6 months old is just not knowing that there's a big possibility that the growth is going to be affected. I mean, is that a fair assessment?
Yep.
So
Yep.
yeah, because like what Salleh was saying, like gadgets are good, like like I think a lot of kids are so smart now with their ABCs and all. I mean, they can read and all that. They just like great with the help of YouTube and all that. And I think it's just a matter of like maybe not so young, like and I think Salleh, you were right as well, like when you introduce, you have to know your child, right? When you introduce it,
you have to know your child.
But I was cutting you off, I'm sorry. So like what would you have things to say to parents from your own experience?
From talking from your own experience.
Oh well,
what did
you need to spend more time with your children.
Okay.
So you need to play is important. I've never realized that play is important.
Okay.
So even with arts, right? Because I noticed that he likes drawing, he likes painting.
Yeah.
So through that, he learns a lot of words, more vocabulary. So this is he learns colors, he learns animals, drawing animals. So he picks up more vocabulary when you spend time with them. So you need to spend time, you need to play, you need to talk, you need to give your attention to them. So that's one. Another thing, another thing is to monitor your child's development.
Right. Yeah. Mm-hmm.
I think that is also important.
Mm-hmm.
So by 18 months, the child should at least have a number of words. I can't really recall right now. So by 2 years old, they should be able to combine 2 sentences. So those are the developments, the milestones that parents needs to faham lah, I would say.
Be aware, at least they know, at least
Be aware, sorry, that's I was looking for the word, yeah.
We understand you, that's fine. So yeah, that means if like a set, like you know where they are. I mean, I think that's really, really important. I think that's a very good point that you raised, right? So only then, like, you know where they are.
Right. Spending time with your child is the only way to know where they are, at what point they are, right? And then that's the only way. But it doesn't mean it has to be a quantity. I mean, yeah, that's the thing. If you you know, it's not about the quality, the quantity is about is the quality time that you spend. You know, it doesn't have to be hours. You know, even like you said, 15 minutes is sitting down with them and like really getting to know them. To me, that's worth a lot more.
Salleh, anything to add to that? Like, what would you say to like fathers? Like any, you know, any specific
from
thing
a father's point of view.
From father's standpoint, I'm just explaining through experience, not as giving advice. You know, we are not an expert, so people cannot take quote for quote for what we are saying. So from experience that sometimes you do need to invest some time with your kids. Do not be too engrossed with your career, because because the most crucial point for your kids is actually 1 until I think about like 5 years old. And then if you're too engrossed, because I noticed that whatever my boss say, I need to follow him. Even at night, I have to submit work, whatever thing. But at the end of the day, does it going to benefit me and my family, or just going to benefit my boss?
Right.
So that's the question that each parents have to ask themselves. You know, I know everyone have to make their own ends meet. But you need to evaluate yourself if it's worth it to spend more hours at work in comparison spending time with your child. And sometimes you don't really need to spend a lot of time. Maybe just have good quality 1 hour time with your child. I think that should be at least a minimum that you need to spend. Yeah, and I understand a lot of, you know, husband and wife, you know, sometimes the husband have to pick up the bills and everything. So, but at least make an effort to spend an hour with your child. That's what I say lah.
Yeah. I mean, totally. I mean,
you know what? This is the
and then one more thing. Sorry to add. Do things that's something that you like to do and your kids like to do together, kind of thing.
That's a great advice. So at least it's fun, right? So you both you know, both parties like it, you enjoy it even more.
Yeah, like for myself, I like to go to the park. I need to spend my time in the park. If not, I get cooped up in the house. I don't know why. So the only thing that I think I could bond with my son is going to the park together with him.
Nice.
So maybe with other parents who may not like to go to the park, find things that you could do together. Just spend some time, some short time with them.
And I like the idea.
I mean, they themselves don't want to spend the entire time with you. They get sick of it as well.
Right. And I think it's great. Like when you do park, it's just simple, right? It doesn't cost much at all. It doesn't cost anything at all. And you can do it anytime when it's not too hot like now. But, you know, it's great. It's just easy.
Yeah,
great.
I think this is a perfect way for us to end, and thank you so much for joining us. I think it's been wonderful.
I mean, we've learned a lot of things as well, and I think it'd be very beneficial for, you know, other people to learn from your you know,
experiences and journey.
And I think, like we've said before, it's like a lot of people are not comfortable talking about it too. Like you said, denial is a real word. So so we are glad that you you were very courageous to share your journey, and start this conversation. So hopefully any parents that watches this knows the next step to do, and you share all the different steps as well. So I think that's great. So thank you so much.
Thank you
for
so
your time.
much for your time.
Yeah, it's been wonderful.
So it's been wonderful seeing
Yeah.
you guys.
Uh,
All right. Okay.